heart disease will end up costing 1 in 3 American women their lives. The first step in combating heart disease is to know what to look for. What are the warning symptoms? A woman can have different symptoms than we think of as being typical for heart disease. Men more commonly get left-sided chest pain that may double them over and send them to the emergency room immediately. Women often have mild shortness of breath, increasing fatigue. Maybe they lose their get up and go and can't make it through their normal activities. A lot of times our symptoms are subtle compared to those that we're used to seeing on TV, and that makes it harder to diagnose heart disease in women. That delay in diagnosis, unfortunately, can lead to women presenting later with their heart disease when it's more advanced and it's harder to treat. That means that women are unfortunately at a higher risk of dying from heart disease once it's diagnosed compared to their male counterparts. So we need to know what we can do to stop heart disease now that we know the signs. Heart disease is preventable in an estimated 2/3 of cases. And prevention centers around diet and healthy lifestyle choices. A healthy diet is one that's high in fruits and vegetables, whole grains, and lean proteins such as baked fish and chicken, and low in saturated fats and cholesterol. Exercise is something that we all need to do every day. The American Heart Association and the American College of Cardiology recommend 30 to 60 minutes of moderate intensity cardiac exercise on almost every day of the week. And the exercise can be anything that you enjoy. You can walk, you can ride a bike, jog, play with the kids, even dancing counts. And the more fun it is, the more you'll enjoy it and the more likely you are to stick to the exercise plan. Heart disease is scary, but it's treatable. And treatment techniques have come a long way in the last couple of years. We're able to do things through minimally invasive approaches that were not available even 5 years ago. For example, a cardiac catheterization, which is the basic procedure where we diagnose and treat blockages in the arteries of the heart, can now be done through the wrist instead of the leg. Using the radial approach allows women to get up and move around immediately after the cardiac catheterization procedure is over. It avoids long hospital stays and reduces your risk of bleeding and other complications from the procedure. For women who need heart surgery, we also have minimally invasive treatment options using the Da Vinci robotic system that allows us to approach the heart through small incisions on the side of the chest rather than the classic big open incision down the center of the chest. That shortens recovery time and allows us to get back to living our